Tamil Nadu, to present the talk on human resource, especially on trainings, credentialing and privileges, rights and responsibilities. Dr. Sentil Kumar is currently associated with Sentil Eye Clinic as NABH coordinator and consultant ophthalmic surgeon. He had served as district ophthalmic surgeon NPCB for 8 consecutive years and was a part of Tamil Nadu Medical Council as a CMC observer. He has received many awards named as Best Doctor Award 2017, Best Performance Award 2018, Best Doctor Award South Zone 2019, and cleared Eye Care Organization Assessor Examination by NABH. Dr. Sentil sir, over to you.
Yes, madam. Good evening in Eye Care. So basically, we are going to deal with 3 things: staff training, credentialing and privileges, and rights and responsibilities of staff. So human resource management, the 9th chapter in NABH, Eye Care thing. It has totally 10 standards and 29 objective elements. So overview of the standards. It has a Eye Care organization should have a documented system of HR planning and a procedure for recruiting staff and orienting them to Eye Care organization. There should be an ongoing program for professional training and development of staff, appraisal system for evaluating the performance of an employee, documented disciplinary and grievance handling procedures. It should address the health needs of the employees, documented personal information for each staff member. The organization should have a process for credentialing and privileging of medical professionals permitted to provide patient care without supervision, and the same thing for nursing professionals without supervision and allied healthcare professionals to assist in patient care. So by definition, who is a staff in an organization? All personnel, sorry for the spelling mistake, all personnel working in the organization, including employees, fee for service medical professionals, part-time workers, contractual personnel, and volunteers. So employee, all salaried personnel working in the organization or employees. So human resource management involves acquisition of human resources, planning, recruiting, and inducting them, followed by motivation of the employees and staff, job design, performance appraisal, and discipline. This maintenance relates to safety and health of the employees. So it is acquiring, providing, and retaining the employees and maintain competent people in right numbers to meet the needs of the customers and community served by the organization. So first is staff training. What is a training? Basically, it's a company or organization's planned effort to facilitate the employees' learning of job-related competencies. What is the need for training? The need for training is a benefit to the individual, benefit to the organization, and thereby benefiting the patients and the community at large. So what are the benefits of training with relate to this staff or employees? It provides continuous learning, good working environment and leadership. Efficiencies and competencies of staff also get improved. Provides overall professional development, knowledge and competencies in systematic ways with defined ownership and accountability of all the staff. What are the limitations? Limitations of staff training are: it has limited time in the organization and competing priorities, lack of interest among the staff, limited budget and training resources, information overload, lack of planning and poor training. Neglecting what happens after training is the most important limitation. Relying on technology to do the work. The factors influencing training are customer service, productivity, safety, employee retention and growth, uncertainty in the economy, extending learning beyond the classroom, use of new technology, and performance of employees. So this performance appraisal, that's more important because it determines the training needs and process of evaluating the performance of employees, it has to be done within a defined period of time, usually around 1 year, to ascertain the suitability for the job or any need in job change is required for that employee and the potential for growth. So these are the things which are assessed in performance appraisal. So in-service training is an organized training provided in workplace to enhance the skill of the staff, teaching new skills relevant to the job. It needs two things for any training: the design of training and the steps followed. Design is a systematic approach to develop training programs. The steps include conducting needs assessment, ensuring employees' readiness for training, creating a learning environment, ensuring transfer of training, selecting training methods, and evaluating training programs. Training in an organization can be of two broad types. First is induction training, followed by ongoing training. Induction training has to be done within 15 days of joining the organization. The training involves related to the organization, department specific training and training in standard precautions. Organization, it is about the vision, mission and values of the organization and patient rights and responsibilities. Department specific is about job specific training, privileges given to the staff and patient care related trainings. Standard precautions, like all we know about personal protective equipment, biomedical waste management, in specific risk employed within the eye care organization like laser exposure or needle prick, etc. Standard precautions apply to all body fluids, secretions and excretions except sweat, regardless of whether they contain visible blood, intact skin and mucous membrane. Training effectiveness. As by Paul Drucker's words, what gets measured gets managed. So this training effectiveness applies both to the trainer and trainees. Need to measure effectiveness of training by post-test, work effectiveness, change in quality delivery, patient satisfaction and return of investments. This training effectiveness or measuring this training effectiveness is more important part as they gives the clue regarding retraining or suitability for the job, etc. Training evaluation, the benefit that a company and its trainees receive from training. The process of collecting the outcomes needed to determine whether training has been effective or not and measuring training effectiveness. Training effectiveness can be measured by the reaction, learning, behavior and the result or the outcome. So what are the difficulties encountered in staff training? As we had already seen, it's the hectic employee schedules, dispersed workforce, different learning habits, lack of interest, irrelevant training and cost. How to overcome the challenge? The keys are consistency, logic and flexibility, as well as ability to consider the learning and development process holistically and to include employees in the process. This is more important as we should not dump some training into the employees. When they are included in the process, acceptance will be better. It may be said that trainees themselves are one of the challenges faced by the trainers. In fact, if you could understand, they are often the solution. So planned retraining after appraisal or post-test, planned retraining is needed, motivation, supervision or change in job responsibility. Developing leaders from within organization is an effective way of training, guidance, motivation, closer supervision while at work from senior staff helps to overcome most of the difficulties in training. So coming to credentialing, it is identifying individuals permitted by laws and regulations to provide patient care with or without supervision. The process of selecting or appointing staff based on qualification, training and experience to provide patient care. So it's the process of obtaining, verifying, and assessing the qualification of a healthcare provider and to have a knowledge of competency of the staff. Privileging is the process for authorizing all medical professionals to admit and treat patients and provide other clinical services commensurate with their qualifications and skills. So credentialing and privileging, it's related to patient care, organization, and to benefit the staff. Overall, the core is safety or protection. Credentialing and privileging is based on prevailing laws, National Medical Council rules, Clinical Establishments Act, Indian Nursing Council, Pharmacy Council, and the rules and regulations of the nation and of the organization concerned, policies and procedures, and like we had already seen, it's the prevailing laws. When credentialing is done, so it is done when a staff enters the organization, that is new appointment or reappointment. So in case of renewal, this renewal has to be done within 2 years or once in 2 years. That is periodic credentialing. What is process of credentialing? That is collecting, verification, and assessment of information related to the education of the staff, license obtained, and the training and experience following the license. That gives an overall current competence of the staff. This is the responsibility of the management or the person authorized by the management, that is medical director or human resource team. The inputs are from the documents obtained from the candidate, previous employer, or by outsourcing via a credential verifying organization. So what are the documents what we collect? Application form details, copy of the certificates, signature verification, photo ID, experience certification from previous workplace, letter of reference if any pending legal action that can be obtained from the nearby police station, third party verification. Privileging is, as we had already seen, it's the process of authorizing a healthcare practitioner to a specific scope of patient care service. Healthcare practitioner applies not only to a doctor but also includes staff nurse, paramedics, dietitian, security personnel, etc. Privileging is based on the qualification, training, experience, and registration. Format for privileging, there is a standardized format. That's a norm for providing privileges, proctorship, that's observationship, duration of privileging, and when independent privileges are given. Types of privileges, this could be temporary, permanent, or emergency. Temporary is still permanent privilege is given, or in case of special situation where there is a government norm. Permanent, as we had already seen, it is not more than 2 years. Emergency, that's privileging the treatment, something given to an patient in case of an emergency by a healthcare provider, but that should be within the scope of the education or license obtained by the healthcare provider. What are the privileges given to medical professionals? Admit and care for patients, ordering investigation, providing plan of care, change in plan of care as per progress or need, performing surgical procedures. For a pharmacist, it is dispensing or selling drugs without supervision based on prescription, control of the storage of medications, intent, ordering of drugs as per need and recommendation by the committee. For nursing professionals, to provide patient care as directed without supervision. Authorization of staff nurses or privileges based on the qualification, training, experience, and registration to assist surgery or procedures, a member in various committees like OT, infection control, biomedical waste, etc. Give injections or Venflon administration as per order in OPD, investigation area like FFA, and in operation theatre. Recording treatment details and progress, reporting and issuing of drugs in ward.
Excuse me, sir. Sir, reminder for time, sir.
Yes, ma'am. To assist in patient care, non-invasive investigation, and they should not provide direct patient care beyond their privilege. So teleophthalmic staff, it's a gray area which needs further from the government. Staff rights, there should be a minimum wage given to the staff, work time as per Labour Act, leave as per government and hospital policy, maternity benefits, grievance redressal, training, and last not but the least, equal opportunity should be given regardless of any discrimination. Responsibilities are towards the patient health and safety, own health and safety, adherence to safety procedures, and adherence to professional work as per hospital rules and regulations. These are the various documents or manual, SOP, or protocol related to recruiting, training, performance, discipline handling, employees fight. And training manual should contain this all the mentioned above things like induction training, ongoing training, procedures, training assessment, impact of training, training calendar. Employees file along with application form received with relevant documents should contain all these things, including the training details, disciplinary procedures, and redressal procedures. Thank you.
Thank you once again to Dr. Sentil Kumar sir for the insight on human resource management.